In 1997, the Palo Alto City Council implemented a ban on medical cannabis dispensaries that overturned the will of their residents when they approved Proposition 215 by a 3-to-1 margin. This November, the people of Palo Alto can finally have their voice heard on this important issue by voting yes on Measure C. Measure C provides for the well-being of Palo Altans, generates revenue for city services, and curtails the spread of illegal dispensaries. Terminally ill Palo Altans currently have no safe or local option for purchasing the medicine they need and are allowed under the law. Measure C would provide them with such an option by allowing for 3 and only 3 medical cannabis dispensaries in Palo Alto. These dispensaries will be located in highly restricted areas of the city, away from schools, parks, residential neighborhoods, and other sensitive areas. Dispensary owners, operators, and staff will be required to pass rigid background checks and meet an extensive list of qualifications. Allowing for these dispensaries to operate legally and transparently will keep patients from turning to the black market and increase the safety of our community. Illegal dispensaries have begun to open in cities across California where medical cannabis has been banned, and this trend is not slowing down. Measure C will prevent it from spreading to Palo Alto. Valuable revenue from the sale of medical cannabis is currently going to nearby cities like San Jose and San Francisco, which tax and regulate dispensaries. Measure C would keep that revenue in Palo Alto. By passing Measure C, the city can begin collecting tax revenue from the 3 dispensaries to pay for vital services like public safety, parks, libraries, and infrastructure, which have been decimated by recent cuts. The people of Palo Alto have already spoken, and they overwhelmingly support medical cannabis and patients' rights. As I've already noted, Palo Alto voters approved Proposition 215 by a 3-to-1 margin. In 2010, Palo Altans approved Proposition 19 to legalize, tax, and regulate cannabis by a nearly 2-to-1 margin. And in a survey conducted last year, likely voters in Palo Alto supported the ordinance contained in Measure C by a margin of 61 to 38%, again, nearly 2-to-1. Measure C will give Palo Alto patients a safe and local option to get the medicine they need and are allowed under the law. Our coalition of residents, patients, public safety and medical professionals, and community leaders urge you to vote yes on Measure C by mail or at the polls on November 6th. Thank you.
Hi, I'm Greg Scharf, the Vice Mayor of Palo Alto, and I'm here to ask you to vote no on Measure C. Measure C would allow the sale of marijuana throughout Palo Alto. These pot shops would be allowed in Midtown, California Avenue, and downtown, as well as other commercial areas of the city. Storefront marijuana shops are hotspots for crime. California cities that have permitted their establishment have experienced negative effects on public health and safety, including an increase in crimes such as burglary, robbery, and the sale of illegal drugs. To that end, the city of Los Angeles recently felt compelled to ban pot shops. Its police chief criticized most pot shops as for-profit businesses engaged in the sale of recreational marijuana to healthy young adults that not only cause a nuisance to the community, but cause a public danger because of a very toxic mixture of drugs and lots of cash. Almost all the marijuana is prescribed by pot doctors who hand out marijuana cards to anyone with cash. This is not a real doctor-patient relationship. The demand for medical marijuana doesn't come from doctors or from the seriously ill. It comes from recreational users. In San Diego County, for example, 3/4 of the medical marijuana patients are under age 40 and 12% are under 21. So don't buy the story that this is about people with cancer and other serious illnesses. The real story is that almost all the marijuana will go to people with no significant health problems. Pot dispensaries will increase marijuana use by our kids, and it will hurt them physically and academically. Children entering drug abuse treatments routinely report that they heard that pot is medicine and therefore believed it to be good for them. The best hope for reducing drug use is to teach children not to start. A child is less likely to use if there is a clear warning. The biggest threat to our children and our community is to blur the line between dangerous, illegal drugs and medicine. Furthermore, Measure C requires that the city allow these pot shops to sell to our children if they have a prescription. It will be easier for our children to legally buy pot than alcohol. Measure C will require the city to issue 3 medical marijuana dispensary permits and to have these permits issued and outstanding at all times, no matter how many problems these pot shops cause. The city will be required to continue to allow them to operate regardless of their impacts. Furthermore, Measure C requires that the city allow marijuana to be grown or cultivated on the premises of these pot shops. Measure C will bring the sale and cultivation of marijuana to our neighborhoods and to our kids. Federal prosecutors are cracking down on California medical marijuana industry. The California Supreme Court is reviewing the state of the law. On the advice of its city attorney in October of 2011, the Redwood City Council unanimously voted to ban medical marijuana dispensaries. Mountain View, Menlo Park, Sunnyvale, Cupertino, and most, if not all, peninsula communities ban medical marijuana dispensaries. In 1996, the City Council of Palo Alto adopted an ordinance prohibiting medical marijuana dispensaries in Palo Alto. Currently, there are no dispensaries in Palo Alto. Let's keep it that way. On February 14, 2012, the San Jose City Council repealed the medical marijuana regulatory ordinance, and medical marijuana dispensaries are not currently legal in San Jose, although a number of them are still operating. In San Jose, for the 18 months prior to the repeal, 77 complaints had been received, including public nuisance, illegal drug use, harassment of passerbys, loitering, smoking too close to schools and daycares, and disturbing the peace. We should not make Palo Alto the center of the peninsula for this commercial activity with demonstrated negative impacts as other cities move to ban pot dispensaries. The proponents argue that marijuana sales will be a financial boon to the city and cite the San Jose ordinance. The truth is that San Jose's gross receipts tax, 7%, is almost double of that proposed for Palo Alto, 4%. And the city's revenue will be insignificant. $1 million in sales generates only $40,000 for the city, assuming 100% collection. Finally, San Jose also restricted the locations, but still had substantial issues, including smoking too close to schools and daycare centers. Measure C will not make any substantial money for the city of Palo Alto. The cost of enforcement, including responding to an increase in criminal activity, public nuisance, illegal drug use, harassment of passerby, loitering, pot smoking too close to schools and daycares, and complaints of disturbing the peace, could substantially impact the city's public safety budget. With residential burglaries on the rise in Palo Alto, the city simply can't afford to become a magnet for all of the negative effects that will follow Measure C. Will send an unwarranted message to young people and others that marijuana is, quote, medicine, and that consuming marijuana is a benign activity or even beneficial to your health. Measure C's proponents have spent over $128,000 so far, and the campaign has barely begun. Measure C is about making money selling marijuana and not helping the sick. Join your entire city council who has unanimously voted to oppose Measure C, our county supervisor, Liz Niss, many former mayors, including Gary Fazzino and Dina Moser, as well as school board members, including Melissa Baton-Caswell, and other community members in opposing Measure C. Protect our children, protect our community. Vote no on Measure C.
I'll try to respond to as many of the arguments made against Measure C as I can. As far as the location of the dispensaries, the Palo Alto Planning Department in October of 2011 produced a map that laid out specific areas where these dispensaries would be allowed under current city zoning and under the provisions outlined in Measure C. As the council members will both recall, these were very restrictive locations. In fact, it would be very difficult to find 3 locations for dispensaries within Palo Alto given the restrictions. They would not be located near parks. They would not be located near schools. They would not be located in residential neighborhoods. They would be located primarily in industrial and commercial zones. As far as the crime factor and the crime element associated with the medical marijuana community, there are a lot of untruths to that argument. The RAND Corporation, which is a bipartisan think tank, recently conducted a study of Los Angeles and their dispensaries and found that crime actually increased in neighborhoods where dispensaries had been located after they were shuttered, which would imply that patients and local residents were going to the black market to procure their legal medicine. As far as that medicinal benefit of cannabis, a bipartisan state commission and task force, including medical professionals, public safety professionals, elected officials, and community members, all found that marijuana indeed does have medicinal benefits to the terminally ill and those in chronic pain, as well as those with mental illnesses. As far as selling to children, there is nothing in Measure C that allows for the sale of illicit marijuana to children. Anyone can procure this medicine with the proper, legitimate prescription from a legitimate doctor and can procure it at these dispensaries legally and safely. As far as whether or not these dispensaries would be allowed to continue to operate despite negative impacts, Measure C lays out very strict provisions for the ownership and operation of these dispensaries. And if any of these provisions should be failed to be enacted, the dispensary can and would be shut down. The only thing that is sacrosanct in Measure C is the ability of patients and terminally ill in Palo Alto to receive and to procure the medicine they need and are allowed under the law, under Proposition 215 and Senate Bill 420, safely and legally in their own community. Many of these patients cannot travel, and they are restricted to a very short radius around their house, so they can't procure medicine at the legal dispensaries in places like San Jose and San Francisco. As for bringing the sale and cultivation of marijuana to the streets of Palo Alto, I find that to be a very naive statement. Marijuana cultivation and sale is prevalent throughout America and throughout most of the world on the black market. And the question here with Measure C is whether we want to continue to allow it to operate in the black market in Palo Alto, or if we want to provide a safe and legal option for patients to procure the medicine they need and are allowed under the law within Palo Alto's borders. Finally, I find it quite disappointing that a number of scare tactics and terms are being used in the opposition to this measure. Phrases like pot clubs and pot doctors incredibly oversimplify and stereotype this issue, and the patients who benefit from medicinal marijuana are not served well by these kind of scare tactics and hyperbole. I truly hope that all the residents of Palo Alto will come together and support the terminally ill among them who need this medicine to better their lives. Thank you.
I'm Larry Klein, Palo Alto City Council member and a former mayor, and I'm here to speak against Measure C. The proponents for Measure C, I believe, are flying under false colors. They use a variety of arguments that really obfuscate, hide what they're really talking about. Let me go through these 1, 2, 3. First, this is not about the legalization of marijuana. If that was the issue, we need to have that done at a far more comprehensive way, at the federal level, at the state level. It's not a Palo Alto issue by itself, by ourselves. The proponents of Measure C talk about this as a revenue-raising measure. Frankly, that's really ludicrous. It would look like, based on San Jose's experience, that this might raise $40,000 or $50,000 a year for the city of Palo Alto. Our general fund this year is over $150 million. So obviously this isn't going to fix any roads or help us provide additional infrastructure improvements or anything of that sort. The proponents talk about this being a measure to relieve pain, to help people who have serious illnesses who want to have marijuana to help alleviate that pain. I took office in 2006. That's more than 6 years ago now. I have yet to receive an email from any constituent along those lines. There is no problem of that, and that's not surprising. We live in a community that has some of the best medical services in the world. And indeed, at Stanford University, there is a pain clinic devoted to the issue of pain, one of the best facilities in the world on that issue. People don't need marijuana to relieve their pain. They have the facilities to do that right here in our own community. So what then is the issue? The issue really is providing recreational marijuana to people who want that. The people who are involved, doctors are involved in granting these medical licenses, readily grant them to anybody who comes along, not somebody who has a medical condition. Indeed, one of our local papers just last month, there is this statement. The doctor there quoted said, he had only, quote, he had only rejected one person among the thousands of patients who had asked for a medical marijuana license. So why should we want to provide for recreational use of marijuana in our community? I don't think we do. All of our adjacent communities, all of our neighboring communities have said no to medical marijuana dispensaries. And the reasons are very clear. Councilmember Scharf well put them earlier on this program by referring excuse me, to the loitering problems, to the use of marijuana by juveniles, and it does not serve to say that the licenses would require that only people over 18. One email I got just last week from a parent, and I'll quote, it says, I have a 16-year-old Pali 11th grader. Unfortunately, his dream in life is to turn 18 and get his medical marijuana card. In the meantime, he and his friends buy their pot from medical marijuana card holders. He then goes on to urge us to vote no on Measure C. I don't think we want Palo Alto to become the hub of medical marijuana use, or let me delete the word medical, marijuana use, period. I don't think we want to be the center, the only community in the whole Mid-Peninsula to have these dispensaries. I think that the proponents know they have a losing case, and that's why they bring up issues that are really false, such as revenue bearing and alleviation of pain, when there are no people who really fit that category. Please join us on the council. Your 9 council members unanimously opposed this initiative. Please join us all. Preserve our community. We don't have a problem now. Why would we want to have one? We've been getting along just fine without any medical marijuana dispensaries. Let's keep it that way. Vote no on Measure C. Thank you.